Hi, it's Dr. John Raymond Baker, DC, and we're excited to announce a new enterprise that we're getting involved in. It's called Baker Appeals Consulting. Now, before I tell you what we do, let me give you a little background and to show you why I feel like that we're particularly well suited to perform this work for you. Before becoming a doctor, I was a freelance writer and I made my living writing, so I have a good background in being able to formulate ideas well. Then in 1989 I became a doctor, and since then I've dealt with insurance companies, workers' compensation carriers, Medicare, Medicaid, all kinds of insurance companies, lawyers, you name it. And then in 2005 I started my own practice in Longview called Baker Chiropractic PA. And while I was involved in that, I also had a side job working for MedWork, which is a company that I worked for, that I was an IRO, independent review officer. And what I did was, in that situation, was I would have doctors that had workers' compensation procedures that they had given to the patients, and the insurance had denied it, and they had appealed it, and I had to look at both what the review doctors had said, the ones that were denying the money be paid, and I had to look at what the treating doctors had put and decide who was right in that situation and whether or not they could be paid and whether or not it was justified within the Occupational and Disability Guidelines, the ODG, which forms the framework of whether something is allowed in Texas in workers' comp or not as far as treatment. So I was able to get a good insight on the minds of folks that review records and want to deny you, as well as treating doctors, and what's really needed to justify, according to the rules and guidelines, whether it be ODG or Medicare or whatever, so that you're able to be paid for the work that you did and keep that money. Now, what's happening a lot nowadays is that Medicare has these companies, you can call them peer review, you can call them a lot of things, but basically what they're paid to do is to look at your records and see if there's any way they can get your money back from you. And by that I mean money that you've already decided you could use to pay payroll or whatever. It's money paid to you based on efforts that you've already given, that you've medically necessary procedures, treatments, whatever that you've already done. So you get this letter saying, oh, you've got 10 grand that you need to give back to us. Now that creates problems at various levels for the company, whether it's a nursing home or whoever. Number one, the money is already allocated probably to pay things like lights and payroll, etc. And suddenly when they waltz in and want to try to demand you give them 10 or 20 grand back, that can really mess up your apple cart. Secondly, you have to handle it in some way. You have to respond to these nice little letters, and usually it gets passed on to some employee that may be already overworked, and now they've got another job that they're expected to do and probably a deadline, so it stresses them. They probably don't have the kind of expertise or training experience that they need to adequately handle the problem, so they're going to do a hurried response that may or may not help you keep your money, in most cases probably not. So if you have, for example, if you have a nursing home and you have a lot of patients that you're dealing with, every year there may be thousands and thousands of dollars that you're having to give back to Medicare because someone didn't know how to handle that appeal. They didn't know how to keep your money that you've already got, so you're having to send all this money back. And honestly, when you're a hard-working person in the healthcare industry and you've got money that you've acquired because you've worked hard and you really needed to be paid, and you have to turn around and give it back, that can be pretty frustrating and can really hamper your ability to manage your resources and your budget, etc. And if you just hand it over to some employee and say, handle this, they're going to be stressed. They're not going to be able to do that job and their other job as well, and it just makes for not a good situation. Now enter Baker Appeals Consulting. It's hard to remember at times. Baker Appeals Consulting. What we do is we take the documentation you have for what you provided. We take the nice little letter that you got demanding the money back and see whether or not we can formulate a good argument saying that no, you need to keep the money, and they have a bogus reason, or perhaps the appeal is perhaps the reason they're saying they need the money back is that it was the wrong box was checked or missed or whatever, but you substantially conform to the laws as far as needing to be paid, etc. But the bottom line is, we look at the records that you provide us, we look at the letter demanding it back, and see if there's a way that we can keep your money from you based on the documentation you provide us. Now, the good thing about it is, if we're not successful, we don't get paid. And if we are successful, we get a modest percentage of what we kept for you. Money that without us, you probably would have had to pay back all of it anyway. So I think it's a win-win both for those companies that we contract to work for and for us. It gives us motivation to be successful, obviously. Now, some companies doing different kinds of work, for example, when I worked in computers, hard drive recovery, data recovery companies would charge you so many thousand an hour whether they got your data back or not. They demanded payment whether they were a failure or whether they were successful. They said, we tried, so we need to be paid. We don't feel that's completely fair in the healthcare form, and we think that if we're not successful, you don't pay us. If we are successful, we'll get a percentage of what we kept for you. And we think that's fair. So if you're in the healthcare industry and you're getting problems with somebody wanting to take your money back from you, especially if you have a nursing home type industry and you're in the nursing home industry, think Baker Appeals Consulting. And I think you'll be pleased with our efforts. And again, if we're not successful, then you don't have to pay us. Can't beat that, I don't think. Anyway, that's Baker Appeals Consulting. Our email is bakerappealsconsulting@gmail.com, and we're going to be posting a website and a blog to go along with it with more information about our company. Like I say, I've been in business since 1989 as a doctor, and so I know a little bit about the healthcare industry and a little bit about trying to keep your money for you. Thanks for watching this video. Have a great day. And remember, Baker Appeals Consulting. Bye-bye.